Good morning, guys. I hope we're all sparkly. I've just taken the dogs for a walk and I've been pondering a very important question. When will I be dialed in? When will I be optimized? It's a question that gets asked quite a lot on the groups. Now, hopefully by the end of this video log, you're going to understand why this is not the correct question to be asking. So let's tackle it. So purely from a pharmacokinetic perspective, we obviously have to consider the half-lives of the different hormones that we're administering. Now, as you guys know, our preferred options are testosterone, cypionate and HCG, microdosing, the most effective way of achieving stable melandrin levels. And ultimately, that is the goal of TRT. It's to reverse the negative symptoms that you presented with. It's to correct the deficiency, and it's to optimize your melandrin profile for long-term physical and psychological well-being. Now remember, physiology is more important than psychology. So pharmacokinetics. It takes 5 half-lives for stable blood levels. So HCG, around 11 days. Testosterone, between 4 and 8 weeks. Why is there such a wide gap, 4 to 8 weeks? If we know the pharmacokinetic profile of the drug, why is there such a wide gap? Primarily due to sex hormone binding globulin, this glycoprotein that gets produced by the liver to act as a buffer, because the half-lives of testosterone, estradiol and DHT are very short. We need to use testosterone 24/7 for its primary purpose, growth and repair. Now, that's not to say that testosterone is not a feel-good hormone. Is it? Right, okay. So it's not unusual for people to present with an element of low mood, anxiety and or depersonalization with low testosterone. So surely correcting that deficiency should make you happy, less anxious and engaged and involved with the moment. That's what we want. Well, it's about the journey, not the destination. I've said it before and I'll say it again. Testosterone does not work. Testosterone allows you to work, to achieve happiness, that sensation of fulfillment. That is a reward. Testosterone is not a reward hormone. It merely allows you to work to achieve the reward. What are reward hormones? Well, dopamine, the pleasure chemical, serotonin, happiness. Now, if you think back to your jaunts to the GP with low mood, anxiety, depersonalization, you're convinced it's not depression, but your doctor is trying to palm you off with antidepressants. He's trying to give you that reward chemical. Now, not realizing that giving you that reward chemical is pointless from the perspective it is not a chemical that you want a high level of 24/7. If we think about the importance of hormonal stability in melandrin levels, this does not apply to reward chemicals such as dopamine and serotonin. So whilst it may help temporarily, lots of guys with anxiety, depersonalization and low mood who go on antidepressants, number one, normally it doesn't work, but number two, if it does work, they often complain of a blunting effect as a result of not being able to experience change. Incredible, isn't it? Right, so why do we do things? We do things to elicit a reaction, a reward. So you can remove psychology and really base this around physiology. Our highest state of consciousness is fascinating, but we act to elicit a reward. And one of the reward chemicals is dopamine and serotonin. But if you've got continually high dopamine and serotonin, you've got nowhere to go. And if life is all about experiences and appreciating a subjective change, which it is, then this is not the goal. So when it comes to male androgen levels, I want to feel good. I want to feel dialed in. So if you've established stable levels, you've titrated the dose according to effect, and you've got healthy levels, it is not the right question. The right question is, what is the right question? Testosterone replacement therapy is about normalizing your male androgen levels to help facilitate growth and repair. We've discussed before, you have a spike of testosterone in the morning alongside cortisol because you're supposed to go and hunt and gather. That's action. The reward is food. You start your metabolism, then you'll have a spike of dopamine. One of my guys came in the other day, sat down, 18 months he's been under my care. He said, "Doc, I'm optimized." So we had a bit of a giggle. And so what's been the major change? What's made the difference? Well, I've packed up my job. I've now got a job that's inspiring, and I've also packed up the booze. So testosterone replacement therapy, this base hormone that allows you to act, to make right choices, positive choices, to elicit the reward. Makes sense, doesn't it? Incredibly fascinating, this field of medicine. We need to rethink how we address testosterone. Whilst it is a performance enhancing drug, it merely allows you to work hard. So when we think about stability, we are trying to achieve stable levels, because undoubtedly hormonal fluctuations elicit a change in your physiology that often manifests as a change in psychology. If you think about timelines, puberty, fraught with emotions, good fun, also some angst, trying to find your place in society. It's just your hormones. So there's an insidious decline in testosterone that comes normally as a result of age, but you can also hasten this by being naughty. But that insidious decline seems very normal because there isn't that sort of sudden drop or that sudden rise. Because stability is what we're seeking. We are not seeking a deficiency. We don't want to have this insidious decline, but we're often faced with, is this it? Is this just me? Well, it isn't just you. So if you are feeling negative symptoms, get your bloods done. There's only one way to find out, and that's measure your quantitative markers. So when we go back to this idea that we are wanting stable levels, stable, healthy levels, hormones are chemical messengers. They must elicit a physiological reaction, which then creates a psychological component. Stable, male androgen levels. The most effective way of achieving stable male androgen levels is microdosing. Use testosterone as the base hormone for you to work your butts off, realizing that the destination is not important. The journey and appreciation of this moment right now is what's important.